The American Brain Tumor Association is pleased to welcome you to our webinar series. My name is Bree Salzman, and I'm a program manager here at the ABTA. As a quick disclaimer, the American Brain Tumor Association provides this information as a service. Information provided by the ABTA is not a substitute for medical advice, diagnosis, treatment, or other healthcare services. This information is not intended to replace discussions with your physician, and the ABTA strongly suggests consulting with your doctor or other healthcare professional regarding your specific needs. Our topic today is very timely, brain tumors and the holidays. And our speaker, Dr. Elise Heidelberg, is a clinical psychologist and assistant member in the Department of Psychology and Behavioral Sciences at St. Jude Children's Research Hospital in Memphis, Tennessee. We're so lucky also to have her as a member of the ABTA Clinical Advisory Committee. She is the head of the new oncology program in psychology, a clinical program that offers universal psychological assessment and interventions to all oncology and transplant patients near the time of diagnosis. In addition, she's a pediatric psychology liaison to the brain tumor and radiation oncology services at St. Jude. Dr. Heidelberg's clinical and research interests include promotion of coping and adjustment through early psychological assessment and intervention, adolescent and young adult psycho-oncology, pain and symptom management, and pediatric palliative care. That's a tongue twister. Dr. Heidelberg has planned several great reflection activities for us throughout today's webinar, so you'll want to make sure you have something to write with and write on, whether that's old-fashioned paper and pen or digital. Either way is good. What works for you is great. Thank you so much for joining us, Dr. Heidelberg. Take it away.
Thank you so much. I'm really just very honored to be here and share this space with you all. So if you'll give me just a quick minute to get my screen and sound shared with you all. All right. So I trust Bree will let me know if you all cannot see my screen. But as she said, my name is Dr. Elise Heidelberg, and I'm just really grateful to be here and share this space with you all to talk a little bit about the experience of brain tumors and navigating the holiday season. So Bree did an excellent job of introducing me and explaining my role at St. Jude Children's Research Hospital in Memphis, Tennessee. One thing that I just want to highlight as we approach our talk together today is that I am the psychology liaison to the brain tumor and radiation oncology services. And while this is my clinical specialty, I just want to acknowledge that the lived experiences that we're going to discuss today, those being navigating the holidays in the context of a brain tumor, are not my own. While the strategies I'll share today are grounded in evidence and in my practice of clinical psychology, this is certainly not medical advice, and would encourage you to reach out to your local teams for more specific information if you need it. I also want to just acknowledge the very personal nature of the topic that we're discussing today, which is the holidays. And I recognize that the holidays mean different things to different people. And there's a range of holidays celebrated across individuals, groups, and cultures. So as such, my goal is really for us to have a conversation that is inclusive of our inherent diversity. And so with that in mind, please take what is useful to you and then feel free to leave what is not. I'm also going to use the general term holiday throughout, but I just want to acknowledge the holidays that I celebrate in the coming months because they might come through in my examples or how I'm talking. So you may hear that come through in our discussion today as well. So here you can see our objectives for today, which include exploring how a brain tumor diagnosis can heighten feelings of grief and loss during the holiday season. Find meaningful ways to balance past traditions with the current realities of living with a brain tumor, creating new moments of joy and connection, and learn how to talk with loved ones about the holiday expectations and emotions, fostering a supportive and understanding environment. So, to achieve these objectives today, I've structured our time together with a consistent flow. So, as we move through the webinar, I'll present some background information on different concepts, share strategies that you can put into practice. And then, as Bree mentioned, I'll offer several opportunities for reflection. And we'll kind of go through those steps several times, building on the experience of, or building on kind of thinking about the complex emotions of the holiday season. The invitation for reflection is just that. It's an invitation. There's no pressure at all. I just put these in here as an opportunity to begin to think about the emotions of the holidays. So you may want to close your eyes for reflection, or maybe write things down, put them in your phone. Just really giving time to notice the thoughts and emotions that show up for you in this space. But that is completely up to you. Um, my goal is really to give you an opportunity to think about these things ahead of the holiday season, although we're kind of already finding ourselves in it in some way. With the busyness of the holidays, it can be challenging to think ahead. And so we might get in the middle of something before we've even thought about how we're going to navigate the situation or the circumstance. So if we take some time to reflect ahead and really kind of think about what's important to us, we'll get more into that later. We kind of set ourselves up to engage in decision making that is aligned and well suited for what we're hoping for the holidays. All right, so let's get into it. I'm going to start with just a general kind of foundation and consideration of the emotions in the holidays. So, importantly, emotions, both pleasant and unpleasant, tell us important things about ourselves. And this is exactly why the holidays are filled with such strong and complex emotions for many people. It's because they matter in some way. The holidays are important to us. And when I'm talking about complex emotional experiences, we're really kind of thinking about how you may experience two or more seemingly discordant emotions at the same time. And one of the in on the Elephants and Tea website, where there's lots of writing published from patients and survivors of adolescent and young adult cancer, Megan described her experience in a essay she published on the holiday season as a spectrum of joy and sorrows. And when I was thinking about how to describe the complex emotional experience of the holidays, I think that's a really profound way of thinking about the experience that often comes with the holidays. Another reason that strong emotions can show up during the holidays is because of different family dynamics. So that can be the history that your family brings to the holiday season. Also, there's more typically, and there can be more time together. So more opportunity to kind of experience these dynamics than maybe you do at other times throughout the year. Now, I want us to spend a little bit of time thinking about the difficult nature of grieving during the holidays. Importantly, grief follows loss of any kind. It can be the loss of a person, and I think that's where many people's minds goes to automatically when we think about grief. But it can also be the person one used to be when we're thinking about life before a brain tumor. It can be the loss of past traditions or the loss of a feeling, like the feeling of security. Um, Grief can also be anticipatory, meaning that you're thinking about future losses and experiencing a range of emotional experiences for a loss that may come to pass. The holidays often bring up feelings of grief because there's many reminders of our past, and then there's at the same time lots of things that bring up our hopes for the future. And grief may impact your experience of the holiday. So you might find yourself noticing that you don't feel like celebrating, or having the thought that you'd rather skip to the holiday altogether. And these are completely understandable experiences when we're grieving. Excuse me. One second. Sorry. And I can't find my. Okay. Oh, yeah. Okay. So now I want to move in to some concrete things that we can do to manage these complex emotions during the holidays. And we'll build on these throughout our time together today. But we want to start by really acknowledging and expressing the emotions of the holiday season. This is an essential first step. Remain open to unexpected joy. So even during times of sorrow, worry, or grief, try to remain open to that experience of joy because remember, we can experience these emotions simultaneously. And because the experience of joy is often connected to things that mean the most to us, they often do occur at the same time. Um, Social support is critical. So think about the people who build you up, talk to them, spend time with them. And then there's also a great resource online put out by an organization called What's Your Grief? And they have 64 tips for coping with grief specifically during the holidays, which is another great way to kind of look through and maybe not all 64, likely not all 64 will be a good fit for you. But hopefully you could find a couple of things in there that you would like to try. Now we're going to move into our first reflection. And so during this time, I'll play a little bit of music in the background and just give you about a minute to think about what emotions show up for you as you think about the holidays approaching. Okay. Now we'll transition to thinking a little bit more about the experience of navigating a brain tumor during the holiday season. So, the holidays, as we've already established, are filled with complex emotions. And then we add in a brain tumor. And these complex emotional experiences are often compounded by the illness experience. And that's whether or not you find yourself on active treatment, an early or late survivorship, or caring for someone with cancer, or kind of anywhere in between those time points. One feeling that doesn't get a lot of attention in popular culture, but is all too familiar to those impacted by brain tumors, uncertainty. During this holiday season, you may find yourself navigating the holidays with an additional element of the unknown. It may be your own or someone else's disease status, future treatment plans, or even how you're going to feel physically day to day. These experiences are incredibly personal to each individual and really can vary depending on where you find yourself in the illness experience. So, if you're on active treatment, you may find yourself needing to balance your healthcare needs with your hopes for the holiday season and the plans that you want to make for yourself or those around you. In survivorship, you may find yourself navigating that new normal if you've recently transitioned off treatment or even notice feelings of survivor's guilt. And for caregivers, you may find yourself grieving for your loved ones' losses, so kind of grieving for them in this space. So thinking about how to manage those complex emotions and healthcare needs during the holidays, we want to start by acknowledging what you need and prioritizing accordingly. So this might be rest. You don't have to do everything or every event, although the holidays do sometimes pull us for that, recognizing that rest is something that we all really need and need to prioritize differently at different times. Um, and with that, it might be helpful to think about this as letting the things that matter less to go. It doesn't mean you let go of them for forever, but it gives you space for the things that bring you the most joy and meaning. And we'll get into more about kind of identifying those things that bring us the most meaning in the holiday season later in the talk to help with kind of prioritizing that. Talk to your medical team about your hopes for the holidays. I encourage this so often is, if there's important dates coming up, talk to your medical team about this and what you're hoping to be able to do. And, see if there's ways that we can that you and your medical team can work together um, for you to be able to engage in those things that are most meaningful to you. Asking for help. So many people view the holidays as a season of giving. So there might be additional opportunities to lean on those around you and ask for help. Also, asking or honoring the memory and the legacy of the people and things lost. This goes back to that kind of first slide of strategies I shared when I mentioned how important it is just to acknowledge and express our emotional experiences. And then for caregivers, one of the most supportive things to be able to do for your loved ones or those that are navigating a brain tumor themselves is listen and advocate for their needs. Um, help um, help set up experiences and spaces that are well suited for the person that you're caring for. So for this reflection, we're going to think a little bit more about our current circumstance. So think about where you find yourself this holiday season and what specific aspects of this space do you anticipate needing to navigate differently than you have in the past? Again, I'll play a little bit of music and give you about a minute to think about this. Okay. Now, as I hinted at on that last slide, um, we're going to move on to talking a little bit about values, hopes, and worries. Some concepts that are really salient, I think, year round in my practice, but certainly kind of come to the forefront when we're thinking about creating meaning during the holiday season. So, values are the things that are most important to us. That's how I start my definition every time I talk about values. Um, and they are, importantly, they're desired qualities of behavior. So, values are sometimes get grouped together with goals, and they are usually related. But values are not necessarily something that we're going to put a check mark by as we would a goal once we've accomplished it. Um, they really focus on what matters most to us. So, for example, if gratitude is a personal value, you might use that almost like as a guide, like how can I act in ways that are consistent with my value of gratitude. Um, so in that way, it's almost like a compass. So it doesn't give us specific instructions, but rather it gives us a general direction. And identifying values is an essential first step in cultivating meaning. And the reason for this is because that's really when we identify what matters most to us, that's really, and we're engaged in um, activities and behavior that are consistent with those values. That's really where we find meaning. And so, as you approach the holiday season, some of the things that you may consider specific to this season, although values tend to be consistent throughout seasons and circumstances, but you may want to start to consider how you want to spend your time this holiday season. So, what are the things that are important to you? Is it spending time with your family and friends? And is that in person or virtual? Um, is it activities that you enjoy the most? It might be baking or decorating. It may even be hosting. Um, I mentioned earlier that many think about the holiday season as the season of giving. So, is it giving to others that brings you joy and meaning? That may be volunteering. It may also be gift giving. And then also, resting and relaxing is an important part of the holiday season, even though, for many, even though what we hear a lot about is kind of the hustle and bustle of the holidays, thinking about, if resting and relaxing is something you want to prioritize for yourself and those around you this holiday season, are you going to do that at home? Are you going to travel to do that? And then taking this a step further, you may begin to think about, okay, what am I hopeful for this holiday season? And what am I worried about? And these I like reflecting on these questions for myself and encouraging others to reflect on these questions because our hopes and our worries are often related, and they usually give us an indication of the things that are most important to us. So, how do we do this? How do we create meaning during the holidays? As I mentioned, let's think about what matters most to you, your values, what you're hoping for. And then this can serve as a compass for navigating the holidays, focusing on the things that are within your control and practicing acceptance and coping for the things that are out of your control. Now, I want to pause here because I'm always cautious when I use the word acceptance. And importantly, acceptance is not a willingness. Um, or acceptance is a willingness. Importantly, it is not a wantingness or a feeling that says like, oh, this is all okay with me. Um, Rather, acceptance is saying, okay, am I willing to tolerate one thing in service of being able to do something that's really important to me? So one example might be like, am I willing to tolerate other people's questions about my brain tumor, my illness experience, in service of being able to spend time with these people who really mean a lot to me? And now, importantly, that doesn't mean we have to answer those questions. And we're going to get a little bit more into that kind of concept, specifically related to boundaries during the holidays, in just a couple of slides. But when we're thinking about acceptance, it doesn't mean um, that we skip the event because something isn't exactly how we want it to be. We ask that question of willingness. Another example might be, am I willing to wear a mask so that I can go to this event that brings me joy? Because a mask is something that your medical team has suggested for being around large groups of people, as an example. Consider creating new traditions or modifying existing ones. Again, thinking about the aspects of those traditions that are most meaningful, um, and uh, and then applying that to this year. So is it where we are or who we're with or something else entirely that makes that tradition meaningful to you? And finally, remembering that you don't have to do everything. And importantly, it is okay to let go of the things that matter less, and remembering to give yourself grace when doing so. So, moving on to our next reflection. Um, when you think about the holidays, what are the aspects of this season that are most important to you? What are the things you're hoping for or worried about? All right. So, um, as I mentioned, we're going to kind of keep building on these concepts as we move throughout our time together today. And so, I hinted at the idea of boundaries on that last slide and with some of the examples I provided. So, um, let's talk a little bit about boundaries. And boundaries are really, I like to think of them as the reciprocal side of our values. For example, you may value um, loving others and being loved, how other a value that of how others respond to and engage with you. Boundaries are important personal limits that protect our well-being, and they're defined by how we desire to be treated. So thinking about what is important to us in our interactions with others, and these things go both ways. How we show up in an interaction and how others treat us. So importantly, and many times frustratingly so, this doesn't mean that we have control over others. And that's why we need to set a boundary. So if someone isn't acting within our boundaries, then we set the limit. So, for example, it might be, I can't come to this event because not everyone is willing to wear a mask. Or you might say something like, that's not something I talk about with people other than my partner. And then um, change the subject or transition out of the conversation. Um, Setting and maintaining boundaries um, is important um, for our mental health and our overall well-being, including our physical health. And when doing so, communication is paramount. Um, and so I have here to share what you need rather than what you don't. And so sometimes when we're trying to communicate our boundaries, it's tempting to say, like, please don't do this, please don't do that. Rather, if you can phrase that and communicate in that in a way of how you're hopeful people will interact with you, like communicate your boundary ahead of time, that can be really helpful in letting others around you um, know how to navigate conversations that are consistent with the boundaries that you've set for yourself. Um, and just to name that, there almost seems to be a greater boundaries are always important, but there does seem to be a greater need to set and maintain boundaries during the holidays. Um, as I mentioned earlier, um, there's more time together. Um, but sometimes I think for the holidays, it almost seems like they're kind of set apart as this like separate time of year where the rules don't apply as they have in other spaces. And so communicating what you need from others and where your boundaries are can be a really helpful thing for your overall well-being, mental and physical, during the holiday season. So, how to do this? Um, Identify your personal, both mental and physical, limits for the holidays. Um, Communicate what you need as opposed to saying what you don't need. And identify people who will advocate for and champion your boundaries, knowing, kind of who is able to um, communicate consistent with your wishes on your behalf can be a really helpful part of advocacy during the holiday season. And remember, not only is it okay to set boundaries, because sometimes I think uh, people around us can make it feel like that's not okay to do. It is, and it's very important. It's important for your well being. Um, and when doing so, give yourself grace, especially if others don't understand. Remember, these are personal limits, and they're limits that you've courageously set for yourself to promote your own well being. So, for our next reflection, take a moment just to notice what thoughts show up for you when you think about setting boundaries. And maybe consider when you've set boundaries with someone you care about in the past and how that went. Um, Now, moving on to our final section of the webinar today, creating meaning. So let's spend some time thinking together about how we might create meaning this holiday season. And really, what this is putting together all the things that we've talked about so far. So start by identifying what's most important to you, especially during the holidays, because this is an essential first step of cultivating meaning. And after you've taken the time to explore that for yourself, think about things that you can do, activities you can engage in, individuals you might spend time with that are consistent with your values and how you want to spend your time. This is where we'll find meaning. Importantly, this is where we find meaning no matter our circumstance, even in the most challenging of circumstances. So that's why we've spent some time thinking about okay, what are the most important aspects of this activity or this holiday tradition or the season in general for me? And are there ways that I need to adjust that given my current circumstances that still foster that feeling of meaning and hopefully some of that bring in some of that joy as well. Um, right into the last bullet here is that joy can coexist with other emotions. And so, even in challenging circumstances, trying to find the things that bring you joy and focus your attention there. We're not pushing those other things aside, those more unpleasant emotions. They exist and they're telling us something about ourselves. Likely, something, it's those unpleasant emotions are giving us an indication that something is really important to us and it means something to us. And thinking about what can I do in this moment to move toward my values, the things that I've said that are most important to me that I want to focus on this holiday season, and looking for the joy in those moments. So, some strategies for this. Think about what matters most to you, your values, what you're hoping for, and act with these in mind. This is where meaning lies. and bonus points if you really take the time to reflect on this experience with intention and notice how you're feeling in these moments and the meaning that is coming as a result of your planning in this way. And remain open to new perspectives as you simultaneously hold the complex emotions of the holiday season in the midst of your brain tumor experience, whatever that might look like for you. So, for our final reflection, I invite you to consider how you hope to make meaning this holiday season. Sorry about that. All right. So, in closing, I hope that I've been able to validate how the experience of a brain tumor can heighten the experience of complex emotions, grief, and loss during the holiday season. Yes, it is a holiday that is portrayed as one as pure joy, but for many, especially those navigating illness and loss, the emotion of the season is much more complex, a spectrum of joy and sorrows, as it was so eloquently put by Megan in her writing about the holiday season. I'm also hopeful that I've been able to reflect on meaningful ways to balance past traditions with the current realities of living with a brain tumor, creating new moments of joy and connection, and recognizing that talking to loved ones about holiday expectations and emotions, in addition to considering your own values, are important in creating meaning and caring for yourself this holiday season. And I want to close just with immense gratitude for you all allowing me to share this space with you today to talk about a topic that is so incredibly personal. I wish you all a meaningful holiday season, and I'm glad to take questions, which you can put into the Q&A.
Well, thank you so much, Dr. Heidelberg, for all the wonderful information. I especially love that just about everything you shared is useful for not just patients and survivors, but also caregivers and their family that are going to be spending time with them as well. So, thank you so much. As Dr. Heidelberg mentioned, we'll open up to questions. So I've been following along for anything that came in during the presentation. So we'll start there, but feel free to add yours to the Q&A section at the bottom of your screen if you've got more. So, um, Dr. Heidelberg. So first one is a really good one, actually. Sometimes I find myself choosing between my needs or boundaries and conflict with others. What recommendations do you have for times when those around us don't support the needs or boundaries that we've expressed? I don't want the conflict, but I also need to take care of myself.
Sure. Um, you're right. That is an excellent question because it really lies at the intersection of everything that we've talked about today. And I think that's where really taking the time to sit down and identify um, like the aspects of the decision that you're trying to make that are most important to you. So lots of these things kind of come down to like decisions like do I go or do I not go? Do I send the holiday card or do I not? Things like that. And and really sometimes how our actions impact others, it are one of the things that are really important to us. So many times when I'm doing this work kind of day to day, some of the values that individuals identify are things like compassion. That entirely or almost entirely has to do with how we show up and care for others. And so um, it is a little bit of a balance to think about when what others need and what you feel like you need and is important to you are kind of coming together and maybe not in a way that seems like they don't fit together. And I wonder about um, I always find it helpful. I know it's not helpful for everyone, is kind of writing the things down. Okay, like what's showing up for me in this situation, and what's showing, if I also imagine that the people that you're talking about are people of importance, right? That's why these strong emotions show up, is because the people that this conflict happens with are often important, especially around the holidays. And then making the choice um, that balances those in a way that feels um, not only I'm going to use the word like safe and healthy for you, depending on what you're navigating in your illness experience, but also what you're hoping for this holiday season. I wish there was a really straightforward, just like, here's what you do when that happens. But I think that's really kind of why I crafted the reflections the way I did, is because like it's so much about like building on these things kind of one by one and how they all come together when it comes to decision making, especially when that decision is one that is important to you and the people that are impacted by it are important to you as well.
Yeah.
The only other thing I'll add is that that's, I think, a really great, important, um, or could be a really helpful time to pull in that strategy of knowing the people around you who can help advocate for what you need and your boundaries, and then also sharing exactly that, what you need and what you hope other people can do in those spaces that is consistent with not only what's important to you, but the boundaries you've set for yourself.
Yeah, absolutely. It sounds like this isn't necessarily something that, we're going to snap our fingers with one conversation, one holiday season,
Yeah,
and everything's going to work out seamlessly. This is an ongoing uncovering, because even just the not even getting to the conversation part, but just uncovering what it is that I need out of this might take a
mhm,
little bit to even take that first step and figure out what those answers are.
absolutely. And if the reflections didn't feel timely for you today, maybe take them with you. And I do find that it can be helpful to think about these things ahead of the conversation, so that you have like kind of that clear compass for yourself, um, kind of bringing in the things that you've identified that matter most, that are most important to you, to help you guide the conversations that certainly can be challenging.
Yeah, absolutely. Yeah. All right, our next question here is from someone who has two children, and they are concerned about their diagnosis casting a shadow over what they feel should be a joyful holiday for them, especially at their age. And so they're looking for advice on how to balance the naive, child-centered joy of the holidays with the heavier conversation and the reality of the circumstance.
Absolutely. Did they by chance mention the age of their children?
Yes, so one is 10 and one is 12.
Absolutely. Okay. I asked that because I think my response will certainly be different depending on the age
Yeah.
of 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 your children and other people on the call who may be navigating something similar. I think where I would start is kind of on that first slide, when we talked about the complex emotions of the holidays and really taking space to acknowledge them and express them when they come up. And they may come up at unexpected times, especially those emotions that feel heavier when you're navigating illness during the holiday season. Um, the important part about that is is allowing those to emotional experiences to happen at the same time. Because what can happen is if we are trying really hard to not acknowledge those things, although they're unpleasant and heavy, and might not be what we were hoping to fill our holiday season with, the act of trying to hold those in may, in fact, make it really hard to experience those meaningful conversations, those meaningful experiences. And some of that might be memory making with each other. And so I think um, allowing space for yourself and your children to express those emotions as they show up this holiday season, while also really looking for that joy. And I think as a parent, sometimes it's creating that joy, especially with young children, in the way that's most meaningful to you and your family, kind of. And that's really where those traditions are going to come in. Are there traditions from the past that you really that are important and that you want to pull forward, even in the context of navigating illness this holiday season, and looking for the joy in those moments, and the memories that are made there, will also be filled with meaning because they're kind of linked to those things that are most important, to you all as a family. So, yeah, I'll pause there, but I'm glad to
Yeah.
kind of expand if that would be helpful.
Yeah, no, that's great. And I know I mentioned up front, but I'll mention it again too, because you referenced that first slide. We are going to share the slides, and of course, the recording link will be available too if you want to go back and dig into what Dr. Heidelberg shared in those earlier slides, to dig into. I'm also thinking, I'm wondering, and just off the cuff, do you see a place or an appropriateness where the reflection questions that you shared are things that might be used in conversations with family at preparing for this as like conversation starters almost?
Absolutely, absolutely.
Yeah.
I think a lot of times, and especially here, kind of how I presented this, we really focused on individual values, but individual values being very different, uh, uh, like by person, and how you're able to act on those might be very different by circumstance. But certainly something to consider is familial values. We also see this come through in cultural values. And so I absolutely think that those are great things to explore, um, uh, with the people that mean the most around you.
Yeah, I love
That's a
that.
great point. I'm glad you mentioned that.
I was just having a conversation with a friend the other day, actually, about family traditions and how things have changed in different ways for different people in her
Mhm.
life. And they're at a place of like kind of reevaluating and discussing is the traditions that we've been doing still working for us? And what was the intent, the original intent
Mhm.
behind them? And can we still hit that intent, but maybe change the how that we accomplish that? So that's like I'm seeing parallels there. We've got another question here. The cost of treatment has put us in a stressful financial circumstance, and we're struggling being able to provide gifts for our children. How do you navigate that kind of situation in a shift of, um, you know, uh, this is kind of what we've been accustomed to and what we expect year over year.
Mhm.
And this year is going to look really different. And that might be a tough conversation to be had because money conversations are already quite difficult.
Absolutely, especially when you're thinking about your children and the holidays. And this is actually something I've been thinking about this holiday season, and um, is just kind of broadly like uh, non-material ways to create meaning and bring in the joy during the holiday season. I will say before I go into that, depending on the age of your children, um, uh, children are very perceptive. And so, um, thinking about how to have a conversation about this in a way that is developmentally appropriate. And so, for the youngest of children, like the magic comes like, not necessarily from those, um, the material things, but Certainly if your children are older and they're going and you anticipate they may notice some differences, is talking to them about that in a way that is developmentally appropriate. And when I use that word, I mean to be honest, but also, um, I think especially with when we're talking about finances, is not to being cautious to share like what they need to know to explain the differences they're seeing, but knowing where that stopping point is. What I will share is that um, I think that, if you're curious about the details of how to do that, if you're in an institution that has pediatric care, you likely have some child life specialists who are great about like, okay, what's like the appropriate way to share this information with children of varying ages. And if you're in an adult kind of institution or care setting, it might be like social workers and things like that, like other psychosocial clinicians that can help navigate some of these things. But I mentioned that I've been thinking about like non-material ways of celebrating the holidays. And I think it will come back to those things about like, okay, what is like meaningful? What is the intent behind this tradition, this gift giving tradition? And are there ways that we can um, be true to that intent, but maybe the way that we do it this year looks different? Also thinking about things like, um, things that might be more accessible, like books and movies. And so I know of some folks that are doing like kind of, this is more specific to Christmas. So I encourage you to think about like how it might apply to other holidays, but like of the Advent calendar. And instead of there being like something tangible in there, there's like an experience in there. So there's a book that they read together, a movie that they watch together. They get in the car and they drive and they see Christmas lights like around the neighborhood. So things like that that might be more experiential and shared time together. If those are things that maybe match the values of your family system.
Yeah, I love those ideas. That's really great. We've got time for just one more question.
Sure.
I'm actually kind of on the other end of the spectrum of what we've been discussing in some ways. They say, I desperately want to participate in my family holiday traditions, but I'm not able to travel this year due to treatment. How can I make this year less difficult?
Oh, great question. Before I go into that one, can I just go back to the last question because I had another thought that I don't want to leave.
Absolutely.
When I was talking about providing developmentally appropriate information to kids, I think that's also a great time to bring in conversation about like um, this is something that our family does at the holidays, and this is why it's important to us, and this is how we're going to do it this year. And so you're also kind of creating that language of values and the things that are most important and matter most to our family. And those things are consistent every holiday season, even though the things that we do to kind of celebrate those or execute those might be different. So that's just like a little bit something I thought of when you were asking this last question. Okay, so this question is about navigating the holidays when treatment really impacts your ability to be close in proximity to your family. Um, so um, I'm wondering about thinking about ways, like think about like the act, what usually, in addition to the like act of being physically together, um, what is it? What are the things your family is doing? Like what are those days? If you were to like kind of look at those days in a video camera, what would you see happening? And let's think about if there's ways that we can um, kind of bring a string between where your family is and where you are. And so, if it is a specific meal that you all have every year, perhaps you can have that same meal at the same time as your family. Um, if virtual, I know people have strong feelings about doing things virtually, but if getting that time to share an experience with your family, this is one of those things that might say, like, okay, this year it's going to look different. The thing that is important to me is to be around the table. Um, can you like be up on someone's FaceTime? And that I will fully acknowledge probably comes with a huge mix of I'm so glad to be able to do this. And it is really hard to see everyone sitting around the table and I'm not there. So I think this is a really important space to think about um, kind of that like video camera situation. What is your family doing? What are the pieces of that experience that you can connect with from your location, and really balancing your decision making out of um, is this something that is going to bring me meaning? Um, and importantly, when the answer is like yes, that would be really meaningful, it might bring some sorrow. And then also that's where we get to that point of really looking for the joy, um, and something that is meaningful and looks very different um, than you hoped it would.
Yeah, absolutely. Well, thank you so much, Dr. Heidelberg. I feel like the core message that I'm walking away with is, the why, the values, the hopes, the desires, the why behind the traditions and the connection and all of those things is the driving factor, and maybe being a little more adaptable around the what and the how that comes to life and things like that. Yeah, thank you so much. Well,
Absolutely. Thank you so much for having me.
yeah, of course, of course. And to everyone watching, you'll receive a link to the recording in follow-up email along with the slides from today's webinar and a bonus resource as well. So keep an eye out for that. We also want to hear from you. Your feedback is not only helpful to Dr. Heidelberg, but it also helps guide our future programming efforts. And we are all ears on anything that you would like to share. I am going to drop the link into this chat as well. So you can scan the QR code. You can go to that website listed on the screen. You can also click that link in the chat as well. It should only take about 5 to 7 minutes of your time, and it really means a lot to us. We are already looking toward 2026 here at the ABTA, and our next webinar will be held on January 27th, Facing a Brain Tumor Recurrence with Resilience. Facing a brain tumor recurrence can be emotionally and physically overwhelming for patients and their loved ones. And during this webinar, Dr. Alex Porter will provide an overview of the medical aspects of recurrence, including common treatment options, goals of care, and key questions to discuss with your healthcare team. We'll also explore the emotional and psychological impact of recurrence and learn practical coping strategies to build resilience. The registration for this webinar is already open, so you can visit abta.org and look on our webinars page, or I have dropped the link directly into the chat, although I do see that I listed survey next to both of them. So I will fix that. The second link is to the webinar. So if you'd like to register for that, we look forward to seeing you there. If you would like to look for more resources from the ABTA, you can visit our website at abta.org, email us at info@abta.org, or call the ABTA care line at 800-886-2282. Thank you again, Dr. Heidelberg, for a great webinar, and a special thank you to each and every one of you for joining us today. We hope you found this information useful and make it a great day.